Brain stroke or cerebral vascular accident. It is a disease or condition in which there is obstruction in the flow of the blood to the blood neurons. The blood provides fresh oxygen and the necessary nutrients for the nourishment and growth of the neurons or the brain tissues. When due to certain reason there is decreased amount of blood which is conveyed through the cerebral vessel towards the brain is decreased due to deficiency of the oxygen supply, the tissue activity is reduced and ultimately may suffer death and fibrosis. So this is the main cause of the brain stroke. There are two types of strokes. First is the ischemic stroke and the second is the hemorrhagic stroke. 80% cases are pertaining or attached to the ischemic stroke. Ischemia means deficient supply of the blood to certain organ. So in ischemic case, there is clot formation or thrombus formation within the cerebral arteries, due to which the blood supply and subsequently oxygen and the necessary nutrients, food nutrition for the nourishment and growth of the neurons is decreased, due to which the function of the brain center is diminished or decreased. The clot is formed by the atheroma formed in the walls of the cerebral arteries. Second is the hemorrhagic one. There is outpouring or the breakage in the vessels or the arteries of the brain. There is leakage of the blood, that is hemorrhage within the brain tissues, due to which the area suffered deficiency of the food supply and oxygen, and subsequently the function of that concerned or the sufferer area or affected area is decreased and lead to death of that area or the neurons. The various causes for the ischemic brain stroke. The hallmark reason is atherosclerosis of the cerebral arteries. The bad cholesterol, the saturated fat, along with the calcium and the other dead particles of the tissue, they are deposited in the walls of the cerebral arteries, due to which there is narrowing of the vessels. And when this atheroma or the material is burst, when that is leaked through the walls, damage the walls of the inner wall of the vessels, and that is material is deposited within the lumen of the cerebral arteries. There is a breakage, there is a pore formation or the burst of the material or the atheroma, and that produces a clot or the thrombus, and that produces the obstruction in the flow of the blood. Now it depends upon the size of the clot or a thrombus form. This is the local formation of the clot, whereas the clot from the other organs, especially from the brain in certain C.v.a, brain vascular diseases, that is called as emboli. That is the portion of the thrombus which are coming from other organs of the body in the brain. They are called as the emboli. So the function and the pathology produces the same. The cell size of the clot that damage the organs, the that centers of the brain which suffer the deficiency of the oxygen supply and the nutrition. The main cause of ischemic brain stroke, atherosclerosis, high saturated fat and the bad cholesterol in the blood, diabetes, smoking, obesity, and the other psychogenic factors, depression and anxiety, they also play part in the nerving of the cerebral arteries. So main function of the bad cholesterol is formation of the atheroma in the walls of the cerebral arteries, which subsequently burst or the produces damage in the endothelium lining of the vessel and comes and become deposited within the lumen of the arteries, and that produces a wall in the passage of the blood stream. So the area which suffer this ischemic process, they become weakened and subsequently and finally become dead. So the cells of the neurons or the center of the neurons which has suffered the deficiency of the blood supply, that loses the functions which has been allotted to that center. So this is the main pathogenesis in ischemic cerebral accident. Whereas in hemorrhagic, the cause is aneurysm. There is traumatic injury to the vessels due to external trauma. Then there is excessive use of blood thinners. So these are the main causes. Aneurysm, especially aneurysm of the arterial vessels. The wall of the vessel becomes saturated and weakened, and there is a leakage, and the blood passes and bleed through the walls of the vessels into the surrounding tissue. And this collection of the blood outside the vessel, that produces lack of supply of oxygen and nutrition, as well as pressure effect over the surrounding centers of the neurons. And that produces the diminished activity of the area and subsequently death of that center of the brain.